Okay, so let's talk a little bit about biceps brachii and pectoral muscle strain. Okay, this does happen a lot with athletes, especially probably more so contact sports where they're trying to either fend off an opponent. You do see it in your throwing athletes as well. It goes a little bit under the radar and does get missed a bit, this particular type of condition, but I tend to find that this is also going to be one of those injuries that you're going to see from a traumatic point of view. So there's no doubt that it does get missed. So let's just review our anatomy very quickly. If we talk about the biceps coming up here, we've obviously got the long head that comes over and attaches into the joint itself, which is quite unique, but we've also got the short head that comes up and attaches to the coracoid process as well. So that's coming down and underneath the pec as well. So we've also got the pec coming across and attaching into the shoulder. So it is not unusual that both of these muscles will be involved in this type of injury. So from a hands-on point of view, from a therapist point of view, what can we do? As we know, with any muscle that gets potentially strained when this fibre is compromised, then we will have secondary trigger points that develop in those muscles. So it's about addressing those trigger points and trying to take a lot of the tonicity out of those. The problem with secondary trigger points, obviously it's part of the healing process, but what it does is it stalls the process for us. So apart from the healing process normally going on the way that it should, we can add to that by reducing these secondary trigger points. So it's about finding where these secondary trigger points lie. Now, it's not like your normal trigger points where we have, say for the biceps brachii, we have trigger points that develop down here. Okay, and then they can refer down to the arm. With trauma like this, these trigger points can develop anywhere through the muscle. So it is really important that we start to work and search through the muscles for the actual trigger points. So they won't be at the site where the pain is. They will be secondary and away from them. Okay, so it's a matter of actually working through the tissue and finding out where they are. So let's look at some searching techniques that I can show you and some techniques that will take some of the increased tension out of the muscle as well. So if we start with the biceps, we're obviously going to look at, so there's the bulk of the biceps there. Arm in extension, if that's okay. I mean elbow in extension. We're going to come down, we're going to start down low, and then we're going to work our way along the medial portion, okay, of the bicep itself. So we're going to come up, we're going to work right along. Now you'll have the arm obviously in the situation where the hand is open. We're going to come up and you'll see the tip here, and then we're going to just go in more medial towards the actual clavicle itself. So I'm going to come up towards the short head of the attachment, okay? So we're going to work along here. We're going to come up, now we're going to hit the edge of the deltoid. So we don't want to butt into the deltoid, so we want to come up and over that, and then we want to sink down and then follow that short head of biceps up through that way, okay? Now, there is no doubt that you'll find a secondary trigger point. Now, normally for me, they'll be in this area here, but that's not to say exactly. They can be above and below that as well. Let's say if we find one of those trigger points in this portion here, really quite simple how we apply our techniques. We're going to come in. If that is the area where we get the trigger point, then we're just going to sit on that and we're going to just strip small, really purposeful strokes through there. Okay, then we're going to follow up with, now we can do this with this muscle because we can actually pick it up. So we're going to come up and we're going to do what we call a pincer grip, okay? So you're going to come up and you're going to use thumb and finger either side. And I use two, so I'm going to pick up like so. And I'm going to come up and it's like I'm going to squeeze the muscle, but I'm not going to actually squeeze it and pinch it. Then I'll just sink into it and then I'll find that trigger point and then I can just hold that trigger point there like so and then work through the trigger point itself. Okay, now if you get too much lubrication on here or cream, you'll find that you slip off. It's not ideal, okay? Now, you can do the same with the lateral head, okay? This time instead of having the hand out, we're going to have the hand in because it's going to bring the lateral head up. And we're going to do the same scenario following that up again. Okay, once again looking for those secondary trigger points. and we will repeat the same process. You find the trigger point, so just work comfortably through there. Do that for a good minute, 2 minutes, and then come back, pincer grip, and then work through as well. Now, if it's the pec we're looking at, then that's really important on how we go about this too. Okay, obviously it's going to be different from men to women because of the breast tissue. So we want to be working in the upper half. So if we've got a pec minor strain up through this area here, it's really important about how you address that and how you can actually find these trigger points. So what I tend to do is you can bring the arm up and put it just between your torso and your arm. So you're going to use your fingers here, you're going to come across the top. Now here's the clavicle here. Okay, we're going to pick up the upper part of the pec, and once again we're going to do like a pincer grip, and we're going to work through the tissue going like so. And once again you can pick up the trigger points in that area there as well, but it helps us let us work a little bit through the range. So we're going down towards, and we don't want to go all the way and pinch, okay, because that's really uncomfortable. All right, so you need to blend it off. So you're going to come down just before you're about to fall off the muscle, re-engage. Okay, so you'll notice that I'm bringing the whole area down and the tissue with me at the same time. So no doubt you'll pick up, especially at the sternal attachment of the pec, a couple of trigger points. So as we get closer to the shoulder joint, there's a couple in there, and we can feel those. Okay, so once we're on those, once again you can just sit and work backwards and forwards. Just hold those, wait for them to dissipate. You know, sometimes they might take a minute, sometimes they might take less, and then we can strip, work through them again. All right, so that's biceps brachii and pec minor muscle strain.